Hello, my name is Shannon Johnson and I'm a Band 5 Therapeutic Treatment Radiographer at the Beacon Centre at Musgrove Park Hospital in Taunton.
Hello, my name is Naman. I'm a Macmillan review radiographer. So similar to Shannon, I sometimes am on the treatment floor, but I also do reviews in the background. So by telephone or face-to-face, so skin checks and kind of checking in with patients about their side effects, whether they're psychological, physical or emotional.
On a daily basis, we treat patients from a variety of different cancers, ranging from sort of head and neck cancers to pancreas, to sort of treating people's thumbs and lymphomas, all different types, and we treat it with radiotherapy, which is a high energy X-ray. Basically, as you can see, we use a linear accelerator, which is like basically a big machine which fires high energy X-rays at a particular point on a patient's body.
It's very important at any time of the year, and even with the pandemic going on, cancer treatment can't really stop for patients during it. I think for us, things are about to change quite quickly. So with the review perspective, instead of seeing patients face to face, I'm now calling them. So there are patients who will go through their whole treatment and I might not even meet them at all. So it's quite strange when you're talking about things to do with COVID-19, how they're managing at home, but also their side effects. And then actually not being able to see them because they're coming in at different times every day for their treatment, and actually we want them to be in the department for as little as possible. So I suppose from the treatment perspective.
Yeah, from a treatment perspective, it has changed quite dramatically, quite quickly. So, for example, we've had to use lots of PPE, so the personal protective equipment. So we now use a mask, eye protection, an apron, and gloves, and we kind of have to change it for every single patient. So, meaning that the time slots that we originally had kind of fitted quite nicely, but now the sort of extra cleaning that we have to do and the sort of extra, PPE that we have to wear takes a lot of time. So sometimes we can be late for patients and things like that. So there's a lot of, extra stuff that go on behind the scenes, which not everyone knows about, and see the anxiety of having cancer as well as a pandemic is also, quite scary for patients as well. So we're there as well, sort of naming on the phone. We're also, when they come in for treatment, we're there for sort of the emotional, psychological side effects in person as well, because we see at the moment, especially with the coronavirus, that patients are a lot more sort of emotional, kind of coming into the hospital, which is completely understandable.
So on top of our jobs, we're giving this video because we're both STEM ambassadors, so we're very passionate about helping young people learn about what we do, and we want to shout out about the therapeutic radiographer as a role anyway across the world. It's quite an important time during the pandemic, as we said, you need to have treatment while you're having any.
For your CREST project, Shannon and Naman suggest you think about ways to make PPE better for healthcare workers and for patients. So something you might like to start with is some research on how PPE in hospitals is used. You could look into the different types of PPE and why they're used for different circumstances. And then you could think about the challenges that using PPE all the time presents. You could think about the challenges for the healthcare workers themselves and the impacts on patient care. Shannon and Naman mention a couple of things in the video, but you might like to think about other things as well. Once you've done that, you can start thinking about ways to improve the situation. How could you make PPE better for healthcare workers and for patients? And you might like to think more generally about how you can help support healthcare staff through a pandemic in the future. For your final project, you could do a couple of things. You could communicate your findings and recommendations to help decision makers in the future, so you could write a report, or you could make a video, or you could find another way to talk about what you found. Or you could share your designs for better PPE and better processes of using PPE. Or you might think of something different that you could also do once you've done your research. I hope you find this interesting. It's certainly very topical, and good luck.